I'm Joanna Markell, the city editor of the Yakima Herald-Republic. I'm here with Mai Hoang, who's a business reporter, who just completed a series of stories over the weekend about Astria Health and healthcare access in the Yakima Valley. Astria is emerging from bankruptcy. Mai, why did they file for bankruptcy in the first place?
I think looking back, Astra Health had a challenge when they acquired what was Astra Regional Medical Center, people know it also as Yakima Regional Medical and Cardiac Center. In recent years, that hospital has been really challenging to operate because they have such a high percentage of Medicare and Medicaid patients. Reimbursements for those patients have been dropping, so obviously really challenging to keep that hospital operating and remain financially viable. What really, I think, for Astria Health made it more difficult was that in the summer of 2018, they had a vendor that was unable to collect revenue. Astria Health says that they lost tens of millions of dollars, it hampered their cash flow, and really made it tough to operate. So eventually they just had to file for bankruptcy in May of 2019.
So we're sitting in front of Astria Regional, which was one of two hospitals in Yakima. It closed in January 2020 as part of the bankruptcy proceedings. What else has changed for Astria in that time?
So along with the hospital, they also closed a series of specialty clinics. They were housed in the building next to the hospital a few months after Astria Regional closed. This past summer, they closed several primary care clinics throughout the Yakima area, so Terrace Heights, Sela, West Valley. It really scaled back Astria Health's footprint in the Yakima area. They still operate a few healthcare services in Yakima, but as far as primary care and the majority of their care seems to be in the Lower Valley. They still run two hospitals in Sunnyside and Toppenish, and then a network of clinics.
And lots of people in town wondering what is going to happen with this building. Is it going to reopen as a hospital?
It seems very unlikely. It was purchased by a local investment group in December for $20 million, also with the neighboring medical building as well. They do want to redevelop it for healthcare uses, and that's one of the reasons this group purchased the hospital. They felt that healthcare access in the region was getting limited, and they want to increase the availability of healthcare services.
So what's next for the future for Astria Health?
So Astra Health is now under its reorganization plan, which got approved by the U.S. Bankruptcy Court in December. As they were getting that plan approved, there was a last-minute development when Multi-Care Health System, it's a nonprofit healthcare system in Tacoma, offered to loan Astria Health $75 million. That was a huge development because it enabled Astria Health to pay off its largest creditor, secured creditor, Lapis Advisors. And so as a result, I think they're in a better financial position going forward, and they stay intact mostly as a local healthcare organization. Usually in bankruptcy, a healthcare organization is either picked up by a larger organization or they really have to scale back their operations. Of course, Astria Health also had to do that, but probably not at the extent of other healthcare organizations. Of course, it's not out of the question for Multi-Care to acquire Astria Health. There is a provision for purchase in their agreement.
And Astria Health is still involved in COVID response. They've been doing vaccine clinics, still very much operating in the Toppenish Sunnyside area.
Yeah, they've done several clinics recently. They just did one in the Valley Mall this past weekend.
Right. If you would like to learn more about Astria Health or healthcare access in the Yakima Valley, go to yakimaherald.com. You'll see all kinds of stories and coverage there. Thanks very much, Mai.